So I'm Tom, I'm a junior doctor at the moment, left 2, so my second year after qualifying. I studied at Liverpool Uni, I'm originally from Newcastle. It's very much dependent on the job, but in a normal hospital job, your medical or your surgical ward job, which is your bread and butter, is what you'll be doing. So that'll be your first couple of years as a junior doctor will mainly be these sort of things. So taking, for example, a normal ward job, so your responsibility will be to the patients that are being cared for in your ward, which will tend to be a certain specialty for the wards. So at the moment I'm working on a renal ward, which is for patients with kidney disease, although we also every ward gets general medical patients as well, which all sorts of different things wrong with them. So for your day, so your job generally split into your day job, which will be your 9 to 5 job, Monday to Friday, and on top of that you'll do on-call shifts, so which I'll talk about in a second. So your 9 to 5 job will be getting in the morning. You'll then in the morning possibly go on a ward round with one of the consultants. You'll see all the patients, come up with management plans for the patient, and most of your job relates to being able to deal with patients if they're becoming well during the day, and also to make sure the management plan is followed, carried through put in place by the consultants, is carried through. So that'll involve making sure blood tests, x-rays, scans are all arranged and happen, and you look at the results and act accordingly. You have to liaise with different specialities of different in the hospital, so often patients have a lot going on with them, so you have to liaise with different specialists and bring it all together to work out the best for this patient. You also have to look after the bread and butter things, so the simple pain relief, make sure there's pain relief prescribed, fluids prescribed if they need a drip, antibiotics prescribed if they've got an infection, so you make sure these are all prescribed safely. You have to communicate very closely with the patients, deal with their concerns, speak to families and make sure everyone's on board. And obviously you have a big role in ensuring that patients go home safely, so sorting out the discharge, communicating with GPs. Also on the wards, hopefully not too often, but it does happen, patients become unwell. It's your job to initially try and stabilise those patients, which is really straightforward things that you get trained extensively from medical school, so you're very well prepared for it. And that's very rewarding when you've got someone who's unwell, and you can do some basic things to stabilise them while you wait for your more senior colleagues to come and make decisions in conjunction with yourselves. On certain other days there won't be consultant ward rounds, and you'll see the patients yourself, which is usually just continuing on plans, but you may have to adjust things, and as you get more experience you take more responsibility for that, which is really, really rewarding. But it's a well-supervised environment during the day, that you've got good contact with your senior colleagues, and your job is basically making sure what needs to happen for the patients happens. So you're acting on behalf of them to make sure everything they need to get done gets done. I think the most challenging is just when you're busy and you've got a lot to do, sometimes things can pile up, and you can be trying to deal with patients who are unwell and you're worried about, who are your priority. And in the NHS at the moment there is quite a lot of pressure on hospitals to try and get people discharged and get people moving. So sometimes what's my priority doesn't really fit in. As a medical practitioner, what's my priority doesn't really necessarily fit in with what's the priority of the managers or the nurses in the ward, which is to sometimes get people discharged and get things that we have targets for done. So it can be quite a challenge to try and balance treating patients that you're worried about and trying to learn from that with doing things that we're required to do, so the hospital doesn't get in trouble. So that's making sure letters to GPs are done on time, which we know we have to do, but sometimes there's a lot of pressure on us to do that quickly. We also have a lot of pro formas and things of paperwork we have to fill in. It can be quite challenging to fit that in, especially when you're busy with patients that you're worried about and you're trying to get things sorted with. So often you can get busy days where you start feeling the pressure and things start to back up. and you've got to kind of take a step back and realise what the important thing is dealing with the patient, people that are unwell, and get them sorted. As a more life point of view, sometimes it can be a challenge. The fact that you will, as a junior doctor, miss out on things because of work. I don't think it's anywhere nearly as bad as what some people think it is, but you do work weekends. Your friends from uni, your mates from uni will get together and do things, and you will occasionally have to miss out on them because you're working. But that isn't as bad as what I thought it would be. Occasionally you will have to work Christmas, you will have to work New Year's, which is a challenge. But you can generally, from experience, you can get time around that. So you will get time with your family. You just have to be a bit flexible that it may not be Christmas Day. Similarly, your holidays are a week long because that's what you can get off. But you do get your holidays, and because you're earning money, you can do things that you couldn't do as a student. So you can do more exciting things, and you can actually, sometimes you don't have the time to spend your money. So the benefit is that of working a lot, when you do have the time to spend the money, you can do better things with it. But I think so. It can be a challenge of work-life balance, but I think generally it's not as bad as people think. And I think, speaking of friends that have done other things at uni, where law and other jobs in London and things like that, they have similar restrictions on their time. So it is a challenge. You do miss out on stuff, but you have opportunities to do a lot. A whole new social network opens up to you, and you have opportunities to do a lot of other things that you wouldn't before. So I think that more than makes up for it. It's a tough question. I really like two things. I think the challenge of the job, the fact that it's different every day, and you're very rarely bored, is a massive plus point for me. You do have to do paperwork and things, but every patient you come across is different. Everything's a challenge. You're very well supported, and it's a good learning experience, within that challenge. So that's what I really like about it. I don't get bored. You're not spending days and then in front of a computer just doing the same thing again and again. You're on your feet and you're experiencing different things, and every day is different. So I really like that. The other thing is working with a lot of different people who often are similar age to you, can be really nice. You're working with other junior doctors on the ward, you're working with other specialties, nurses, physios and everything. You communicate all the time with them, and they're often similar age to you, and you can get on really, really well with them. So you're in a work environment surrounded by people who generally are your own sort of age who you get on with, which if you compare to a lot of other careers in office and stuff, you don't really get that. So it's really nice that. And again, working with you, there's a very good social life attached to that, and you do tend to go out for meals with with the other people you're working with in your job. You meet a lot of people through uni you stay in contact with, so I think that's really good. So thanks a lot for listening to this. All your best in your applications and your experience in medicine in the future. Make sure you use all of EdMed's resources and subscribe to them on YouTube, and get in touch if you've got any questions at all.